Hello and welcome to Addressing the COVID-19 Crisis, our weekly open forum webinar series for pharmacists. I'm Michael Hogue. I'll be your host for today's program. I'm president of the American Pharmacists Association and dean and professor at Loma Linda University School of Pharmacy in California. We've got a great subject for you today. Playing off of our immunization theme from last week, we're going to discuss the Department of Health and Human Services authorities that have recently been issued for pharmacists to both prescribe and administer childhood and COVID-19 vaccines. There's lots of requirements that were associated with that, and there are a lot of implications for pharmacy practice. We've heard many questions and a good bit of confusion about what is and isn't allowed, and so that's where we're going to focus our time today, trying to provide you with important clarifications. Now, joining us today, we're very pleased to have with us Rebecca Sneed, the Chief Executive Officer and Executive Vice President of the National Alliance of State Pharmacy Associations, or NASPA. Becky's going to be sharing with us the perspectives from the states. She has been, obviously, because of her role, working very closely with all of the state associations to make sense of all of the requirements and how they integrate with existing state requirements and state laws. And so we'll get great clarification from Becky, I'm sure. And in addition to that, we'll be joined, as we are every week, with Elisa Bernstein. Elisa's Senior Vice President of Pharmacy Practice and Government Affairs for APhA, having spent a career with the FDA, over 30 years there at the FDA. Elisa helps us as an attorney and pharmacist to be able to understand some of the legal issues surrounding these rules that come out of HHS. And of course, Elisa and her team network very closely with HHS officials to be able to get clarifications and understandings of all of the things that come with these rules that are put out by HHS. We're also being joined by Mitch Rotholtz. Mitch is a vaccine expert, and he's the Chief of Governance and State Affiliates for APhA, a longtime APhA staffer that also serves as the Executive Director of the APhA Foundation. Mitch's insight into vaccines and working with vaccine coalitions is highly regarded and well respected in the profession of pharmacy, so we'll be pleased to have him with us. And then during our Q&A session today, as we are every week, when you have clinical questions about COVID-19, the drug therapies, or other things related to COVID-19, Dr. Dan Zlot, our Senior Vice President for Education and Business Development, will be here to answer your questions. For those of you joining us for the first time, you may not know that Dan was previously on the staff as a pharmacist specialist with the NIH, and his specialty is in oncology and immunology, and so he brings lots to the table as it relates to COVID and understanding how our therapies work. So what we're going to do today is we finished up with these introductions. Just shortly, we'll have a very brief presentation about the regulations that have come from HHS, or the rulings that have come from HHS. And then I'm going to have an interactive discussion with Elisa and Mitch and Becky, talking about some key issues. I want to point out to all of you that in your GoToWebinar control panel, there is a question box. If you have questions related to the HHS rulings on childhood vaccines or on COVID-19 vaccines that you want to be sure that our speakers address today, go ahead and type those in now. Either the speakers will get to those during their presentations, or alternatively, I will call on you, or I will ask the question for you, whichever way we want to make it work and whatever works for you. Now, if you would like to be able to be called on and verbally ask your question, we ask that you do one thing. If you are on a landline phone or a cell phone, would you please enter your audio PIN number now, if you've not done so already, into the telephone, so that when it comes time to call on you, we can unmute your line and you'll be able to speak. For those of you joining by computer, when we unmute your line, the only thing you need to be able to do is ensure that that microphone that you see on the GoToWebinar control panel is clicked from red to green. And you can control that on your end to unmute your line after we unmute you on our end. We'll just ask you to keep your comments brief so that we can take as many questions as possible. And also, we want to encourage you to share your personal experiences. We love getting questions and we love having our experts being able to answer those questions, but we really, really value getting your experiences from the field and sharing with us what you're seeing happening in real time. That helps all of the attendees be able to understand the issues at a deeper level, and so please share your experiences with us. Now, the handout for today's webinar is also in the GoToWebinar control panel. You can download that. All of the links in the handout are active and will take you directly to the site that you want to go to be able to access the additional resources or websites that are available, and so you can access that. But if for some reason you forget to download it during today's webinar, no worries, no problem. You can go to pharmacist.com, that's pharmacist.com, click on the COVID-19 Resources page, and you'll be able to find all of the recordings, including a recording of today's webinar, on that site, along with all of the handouts from each week's webinars. And you can go back and listen to any week that we've had these webinars previously. So this is our 24th week of doing these webinars, so you'll find 24 episodes available to you online. So with that, I'm first going to call on Elisa Bernstein to join me. Elisa is going to share with us the details of the HHS Authorities prior to us diving into the Q&A section. Elisa, share with us a little bit about the HHS Authorities that have been given.
Hi, great. Thanks a lot, Michael. And welcome, everyone. So for those of you who we know as week 24, we have a lot of regulars on the webinar today. And so as those regulars, and if you're not a regular, every week towards the end of the webinar, I or one of my colleagues on the government affairs staff gives an update on some of the new happenings, authorities, and new information that's coming out of our federal agencies and Congress. And I usually only have a little bit of time to dive into those. Now we're having a whole session, so I can go a little bit deeper and explain a little bit more about the new authorities. If you can go to the next slide, please. So APhA has been working really closely with our national pharmacy partners and leading efforts to expand pharmacist authority in very different ways during COVID. One of the key areas that we have been using our strength in numbers is letting officials know that pharmacists are here and we're accessible and ready to vaccinate. And so we sent a letter about a month and a half ago to the administration, really saying we are ready. Give us the authority that's needed across the United States for all pharmacists to immunize. And in that letter, we not only asked for COVID-19 vaccine, and we also recognized that childhood vaccines, according to CDC, were decreasing at a rate. And so we, in there, also included that pharmacists are ready as well. Well, HHS and the administration came through, and about 2.5 weeks ago, they came through with authority for allowing pharmacists and authorizing pharmacists to order and administer childhood vaccines according to certain requirements, and I'll go into those in a moment. And then also just recently, the administration also authorized pharmacists to order and administer the COVID-19 vaccine when it's available. And this also includes pharmacy interns. And I'll go into a little bit of those requirements in a moment, but I just want to also make it clear that the authority that HHS, U.S. Health and Human Services, has granted, it authorizes us to do this only during the public health emergency. And so we will be fighting to try and maintain some of these authorities beyond the public health emergency. But right now, the focus is just on the pendency of the public health emergency. Now, how long will that be? I have a feeling that that's going to be quite a while. There are a lot of authorities, even beyond just vaccination, that are, a lot of the economic and financial authorities are tied to a public health emergency. So that's probably going to continue, so those authorities are maintained. The other key piece of this is that the authorities that were granted to pharmacists preempt state laws that are a barrier to national implementation. So in essence, the authority says, regardless of what your state scope of practice is, this is what pharmacists are able to do in states across the United States. So that's huge. And so there are a number of states that are having some issues in trying to remove some of those barriers, but we'll talk about that also as well. So if you can go to the next slide, I'm going to go into these the two different authorities, and they're really close, but there's some minor differences. So who's authorized? State licensed pharmacists can order and administer, and state licensed or registered interns who are acting under the supervision can administer. Some states don't license or register pharmacy interns, but for the most part, they are registered or licensed. For the COVID-19 vaccination, we're authorized to give it for anyone 3 years or older. For childhood vaccines, 3 to 18 years old. The vaccine for both of them must be FDA authorized, which would be under an emergency use authorization. So that's not full approval, but it is meeting whatever standard FDA has for the safety and efficacy for under the emergency use authorization, or FDA license, which is the approval mechanism for vaccines in the United States. They can be ordered and administered according to for ACIP, CDC's recommendations. So for the COVID-19, whatever is recommended, and then there are specific recommendations for childhood vaccines, as well as specific schedules. And so that's all, there's a link here to go to the CDC website. For training, what the authorization is you need to have at least 20 hours of ACPE approved practical training that includes hands-on, clinical evaluation, contraindications, recognition of emergencies, and how to address emergency reactions to vaccines. APhA does have a certificate program that meets the requirements for the pharmacist training, so I had to put a plug in there. And there's a link also as well on the slides that you'll get. Pharmacy intern training, somewhat similar. That also has to be ACPE approved. For the pediatric vaccinations, the authority goes into a little bit more detail of what has to be in the training. For all pharmacists and interns must have current certificates in CPR. We know that in some states that has been waived because under the public health emergency, it's difficult to take the time or even to be in person in order to get the renewal. So that's an issue here that we're looking into to be addressed. And then CPE, the pharmacist has to have at least 2 hours of ACPE approved immunization related continuing program during their licensing period. And again, a plug for APhA. We have a lot of educational programming in our education library for immunization on pharmacist.com website. There are record keeping requirements that need to be followed. They're pretty similar for COVID-19 and for pediatric vaccines. For the pediatric vaccine, you have to report to the local IIS, the local immunization information system, or the vaccine registry, and likely there will be some other registry for the COVID-19 as well. Well child visit, I'm I'm going to just briefly touch on this. I know Mitch is going to explain this a little bit more, but part of the problem and concern that was raised by physicians and pediatricians who always or typically are giving childhood vaccines is, well, if they're going to go to the pharmacist, they're not going to come to us for their well child visit. And this is a team here, and we need to work together. And so written into the authority is that if the patient is 18 years or under, that the pharmacist must inform the patient and the caregiver and that of the importance of a well child visit and visiting with their pediatrician or other primary care provider, and then also refer that patient as appropriate. And APhA has worked with other associations to develop some materials to help and templates to help with that Mitch will be talking about. And then finally, for the COVID-19 vaccine, there is a requirement to comply with whatever agreement CDC comes up with respect to if you are a vaccine provider. So I will stop there.
Well, great, Elisa, thank you. And don't go away. I'm going to ask Mitch Rotholz to join us, and then I have a question for the two of you, and I'll let both of you to respond to this question as Mitch joins us. Under the record-keeping requirement, I noticed that it says that that pharmacists have to comply with record-keeping and reporting requirements of the jurisdiction in which they administer vaccines, i.e. the state, and including reviewing the vaccine registry or other vaccination records prior to administering a vaccine. That last part after the comma, okay, including reviewing the vaccine registry or other vaccine records. Is it correct to interpret this to mean that if a state is silent on vaccine documentation, let's say a state law doesn't really say anything about vaccine documentation, is it correct to interpret that this order means that pharmacists need to make an effort to check the patient's vaccination status through the registry or some other record mechanism prior to administering? Is that a correct interpretation? Mitch, what's your thought on that?
Yeah, Michael, if the authority is coming from the amendment, so your state doesn't allow you to do it except the amendment allows you to do it, yes, then you should make a good faith effort to check with the registry to see if there's history in there that you could use. Some states have bidirectional ability to check immunization information. So as long as you make a good faith effort, I think you would satisfy that requirement.
And not to dive too deep into registries, but I just want to point out here that I do know that a lot of pharmacist employers do transmit data into state registries. We hear good information from the Association of Immunization Managers that especially chains are doing a good job in some cases of putting data in. But there's a lot of times when pharmacists within those organizations are not able to actually access the registry, and that might be because the system of the pharmacy won't allow them to do it, or that might be because there's not bidirectional exchange, as you refer to, Mitch. Would you say that that's an issue that chain pharmacies and independents need to focus on and try to resolve quickly?
I think it's always been the intent of meaningful use to have that two-way exchange of information. In a lot of cases, the information exchange is happening seamlessly, so the actual pharmacist at the care level doesn't know where the information is coming from. It may show up on their computer. So given in this time of the emergency declaration, I think doing the best you can of getting the information. Remember, it's either getting it from the registry, you can get it from the physician that is on record for that patient, or even asking the patient and getting that history. I would interpret that as making a good faith effort.
Okay, great. That's great. Now,
Michael, could I just add something?
Sure.
Do you mind? I just want to add for COVID vaccine, the patient's going to need two, and what all the information we've seen is that when you get one from one manufacturer, the second one is from the same manufacturer. So that goes to, and we're talking about record keeping here. That's why record keeping it's going to be so important. So regardless of what the requirements are that are imposed by your state, as practically speaking, there's going to have to be some system in order to ensure that the type and the number of doses are being carefully monitored.
Yes, that's exactly right. Now, Mitch, I think you've got some information to share with us. I'd like to pull up the next slide. APhA has worked with a coalition to develop a template, a mechanism for pharmacists to be able to be compliant with the pediatric immunization piece that Elisa just covered. Mitch, could you maybe in a couple of slides cover with us what that looks like and how pharmacists might access the resource that's been created?
Sure. Thanks, Michael. So a task force, as Michael said, of APhA, NASPA, NCPA, and a group of state pharmacy association executives developed resources that the practitioners can use to satisfy the requirement within in both amendments about notifying the patient and their caregiver, the adult caregiver, about the importance of that well child visit. When HHS developed the amendment, they looked at states, and a couple of states had this already in their requirements, and so they added that into the amendment. And so to satisfy that we actually developed 3 different resources that you could use to satisfy that. One on the screen here is a referral form, which basically talks about you're giving that patient what vaccines, what you observed, and that you were referring the patient to that physician's office or the clinic for well child follow-up. The next slide, please. We also developed a brochure that talks about the importance of the well child visit. So again, you give this to the patient, that's educating them about the importance of the well child visit, and that would satisfy the requirement as well. And then we have a template letter if you want to utilize this with your patients. You're filling in, their name, the logo and information about your practice and your signature, and that this could be given to the patient so they can then take it when they go to their practitioner for the follow-up well child visit. These are all available on the website. Again, these are tools for you to use to help you satisfy that requirement.
This is such a great resource, and I really commend APhA, NCPA, and NASPA for working together to create this for pharmacy to be able to use as a profession. So thank you for that, Mitch and colleagues. Becky Sneed, please join us on camera here. I have a really important question to ask you that's based on Elisa's presentation. I think when I went through pharmacy school, which I realize was a little over 2 decades ago now, I was always taught in my pharmacy law courses that when you're presented with a state law and you're presented with a national law, you adhere to the one that's the most stringent, that you follow the one that's the most stringent. And so now, for really the first time that I can recall in my professional career, the federal government has issued a pharmacy practice regulation, and there's some confusion. So could you help us tease out from state association perspective and from a state perspective, how do pharmacists make sense of this? I mean, can we really order and prescribe these vaccines even if our state law says we can't do that? You're muted, Becky, sorry.
I do that all the time. Thank you very much for reminding me. The answer is yes, but it is complicated. And there are some state nuances that we need to consider. I think that what we need to keep in mind is the intent of the executive order and the amendment. And the intent is to increase access. And they want to, for the first time that I've ever known, reduce barriers. So the federal government is saying you can do things that are restricted in your state unless your state is more liberal. If your state's more liberal, we don't want to restrict you. So it's sort of a different rule of thumb from what we were taught, Michael, in pharmacy school, where you follow the most strict. It's very clear in their footnotes. It's very clear in conversations that we've had with HHS. They're trying to remove barriers to pharmacists providing childhood vaccines and COVID vaccines. So, that's the intent. And now we have to work with state, attorney generals and boards of pharmacy and get them on board with what the intent is.
That makes sense, that we've got to look at the intent. That's a very important thing. And I'm wondering, Becky, what do you think are the biggest challenges that the states have with implementation? So what are you seeing on the ground in real time? I mean, these orders are basically a couple weeks old at best, and I'm sure you're getting new questions every day. But what would you say are the most common challenges that we need to be aware of?
I think some of the most common challenges are when state requirements are not as restrictive as the HHS order. So I can give vaccines in my state 18 and older, but I don't have to go through a 20-hour CE program. But I want to now give it 3 to 18. And the HHS order says I have to have a 20-hour CE certificate program and a 2-hour continuing education every renewal. So they're the more restrictive. I have to have a current CPR certification, and maybe my state under executive order, because it's hard to get live CPR training right now, has waived that. But the executive order says if I'm going to do this, and this is more lenient than what I can currently do in my state, that I still can't participate unless I follow the HHS order. So I think that they're the source of the majority of the questions that we're getting. We're going to be able to work through all of those. I can tell you that this is a tremendous opportunity for patients, and I think pharmacists are absolutely the right health profession to engage and take care of our patients. And we just need to embrace it and work through those challenges with our state, and whichever authority, whether it be our attorney general, whether it be our the governor's office or the board of pharmacy that is asking for additional detail. We're a highly regulated profession, and it's not unusual or unexpected that we have these questions, but let's work through them very fast and let's get to taking care of patients. And that's where I think every state is.
Yeah, so just to kind of follow up on that, Elisa, let's just deal with the very first issue that Becky brought up there. She brought up this issue of the CE requirement. So I'm licensed in the state of Alabama. Alabama does not have a continuing education requirement at all for pharmacists to have achieved relative to vaccines. So by virtue that I'm a licensed pharmacist in Alabama, I can give vaccines. Now this order has come out from HHS saying that I have to have 20 hours. Do I have to have 20 hours or do I not have to have 20 hours? What is it? What's the answer to that question, Elisa? Can you give us some clarity?
So if you already have the ability to do that in your state and you can do it without the CE, then you don't need it. If you are relying on the authority under the PrEP Act, then you need to meet all those requirements in order to be able to do that. And that's our understanding. Yeah.
That's the key. And so just to put a fine point on it, I want to try to be as clear as we can with our listeners, and let's see if we've got agreement with all of our panelists here. So what we know is true today is that if your state, for example, allows you to immunize people who are 18 years of age and older, and you don't have to have CE to do that, but you can just do it because by virtue of your licensure, then you're doing that under state authority for 18 years and older. So giving, for example, COVID vaccine, you don't need the 20 hours of CE. But if you're going to provide pediatric immunizations under the pediatric order for 3 to 18-year-olds, and your state only authorizes normally 18 and older, then you would have to have the 20 hours of CE in order to be able to be covered under this federal order for pediatric immunizations. Did I capture that correctly? Becky, Mitch, Elisa?
Just give one clarification, almost, Michael. I think if you have an authority, let's just use if you can do 6 years old. Okay, so your state already gives you the authority to do 6 years old. You could provide that under your current state law authorization. If you want to go down to 3, then you have to follow what's in the amendment.
Okay. All right.
And not to make it more complicated, Michael, but if you can do any age, but you need a collaborative practice agreement, but you don't need the educational requirements, you can do it under your collaborative practice agreement. But if you want to do it without a collaborative practice agreement and you want to order, prescribe, and administer it under your own authority, then you're going to have to follow the requirements.
Yeah, this is great, and I appreciate this clarification. I really hope pharmacists that are on our webinar today that you will advocate with your colleagues to go to pharmacists.com and the COVID-19 resources and listen to this webinar if they aren't on live today, because these clarifications we're providing we think will help really decrease confusion in practice. So please recommend that your colleagues listen to today's webinar asynchronously. I'm going to call on an audience member. I think we have maybe Jenny Minchow, but I think she's online as Marcia Muting, maybe sharing a computer. Marcia Muting, M-U-E-T-I-N-G. And I think the staff have unmuted your line if you're on. Okay, I don't think your line's unmuted, or maybe she's bounced off. So let me ask the question. If pharmacists can prescribe COVID vaccine, which is essentially what ordering means, it means prescribing, will insurers reimburse for the vaccine and the administration fee, since there wouldn't be a prescribing MD? That's a really important question, because as we process prescriptions in a pharmacy and transmit claims to the pharmacy benefit, we have to enter in a prescriber's name. What if the pharmacist is the prescriber? How does that work? Any thoughts on that, Elisa or Becky or Mitch? And I know Ann Burns, one of our internal experts on billing, is on the call. And Ann, you're welcome to chime in on this as well.
So I'll start, and then Becky and Lisa. I mean, the amendment gives you the authority to order. So you are the prescriber. That's the first thing. Second is the COVID vaccine is going to be provided at no cost to providers or patients, the actual vaccine itself. If we use the experience that we had under H1N1, the administration of the vaccine was covered by Medicaid, Medicare, private health insurance. That's the model that everybody's been talking about. But what's still to be determined from Congress, if you don't have insurance, will that be covered under some other mechanism as well? The intent is to make it at no cost to individuals. In terms of pharmacists, again, like we do for flu, like we do for other vaccines, that shouldn't be a barrier. Now, it's going to be each individual plan that needs to be put in place, but the intent is that, and there's actually some legislation that's being considered in Congress that would allow, if it's ACIP recommended, that an ACA benefit covers all eligible providers, which would be in this case pharmacists in the Medicaid program.
Okay, Becky or Elisa, you want to add to that on the pharmacist prescribing piece?
Yeah, I would just add a couple of things. I think that because it is a government-owned vaccine, and they are going to require all providers, not just pharmacists, to enter agreement. Those agreements would say you are eligible to bill the private payer or Medicaid or Medicare if it's covered for the administration. But in addition, there is a program being set up under HRSA that will cover the uninsured that you would be able to bill and get reimbursed for. But if someone, and there shouldn't be cost sharing, but if there is cost sharing or there is any patient that denies the ability to pay, the agreements with the state health departments usually requires that the pharmacist and pharmacy provides it to the patient, even if they deny the ability to pay, if there is a payment that is required of them. I think this is a perfect example of there's a public health need, and we are going to need to do everything that we can to make sure that our costs are covered and we are able to bill when we can. But when we can't, we have to provide the public what they need. And that's where I think pharmacists actually shine. I think this is our moment. We embrace it, and we take every opportunity to advocate for appropriate reimbursement for the administration, but we also have to take care of people.
Yeah, and a related question just came in on that from Dr. Podgorski. She said, if vaccine is free, will there be payment for administration? I mean, will there be some compensation? Sounds like what you're saying is that the Fed's plan is yes, that there will be an administration fee.
Yeah, and in conversations with CDC yesterday, they were thinking that you know, at least through Medicare and public programs, that it would be covered.
Okay, all right, great. Christy Kenny, one of our participants who doesn't have audio access, says that if my state authorizes flu only for 6 years old, would we need the 2-year annual CE for under 6 or for over 6, since the new order includes all vaccines and just flu? Becky, what's your interpretation there?
Yes.
Yes, yeah, you'd need to comply with all of those requirements that are there. Yeah, okay, great. Lisa Smith, let's see if we can unmute your audio. Staff, Lisa Smith is the pharmacist we're going to call on now. Lisa, make sure your microphone.
Yeah, can you guys hear me okay?
Yeah, we got you, Lisa. Please ask
My question was just around the immunity that's offered by the PrEP Act, especially as we think about the COVID vaccine. My understanding is that you would need to comply regardless of your state requirements with the HHS requirements in order to be covered under that immunity. Is that accurate?
Lisa?
Yeah, yes, that's correct. If you want the PrEP Act immunity, you need to follow all the requirements strictly in what the HHS authorization contains. That said, there's other immunity for vaccines that is available under other administrations like VAERS and other maybe in state laws. So you need to, like I said, if you want the PrEP Act, but in some respects that's just narrow because there are other alternatives. I don't know, Mitch or Becky, if you have anything to add.
No, I think we're already covered on other vaccines, as you said, under VAERS and the insurance program for the federal government. So I think that covers the other vaccines. But for COVID, again, the PrEP Act gives you the specific COVID coverage, unless your state covers it a different way.
Yeah, and just to kind of reference something that Mitch mentioned, he mentioned the Vaccine Adverse Event Reporting System and the National Vaccine Childhood Injury Program do provide protections to providers when a child or an adult who receives a vaccine that's also indicated for children happens to have an adverse reaction or untoward effect from the vaccine. It's a federal compensation program that many of you may be aware of that provides additional coverage for you. So again, I just refer you, there's more information at pharmacists.com about that. Becky, we've gotten a comment from a Connecticut pharmacist who says that unfortunately the state of Connecticut has issued a letter to the State Pharmacy Association saying that Connecticut statute prevents pharmacists providing vaccines to any person under age 18, and the HHS guidance does not preempt that statute. So the state of Connecticut is trying to fight against HHS through a formal letter. So I'm wondering, Becky and Elisa, if you could maybe just comment on what is NASPA and APhA doing specifically to support the state pharmacy associations and advocacy and overcoming these sorts of things. Becky, maybe you could go first, and then Elisa.
Yeah, I wish I wasn't shocked by that, but I'm not shocked. Or I wish I was shocked. I'm not. You know, states have rules and regulations that they hold very, very closely and they feel very passionate about. And I think we have to work through them in a state by state manner. I think that we can connect the state of Connecticut or whoever is issuing that opinion through their state pharmacy association to HHS so that there can be a dialogue as to what the intent is. And, you know, we'll take that tactic first. And then if there's other tactics that are needed, we'll work through that, you know, one by one to make sure patients are served. I mean, it's all about our children, and that's where we have to stay focused.
Focusing on the patient. Elisa, anything to add there about APHA's support of the states here?
Yeah, just in addition, we work really closely with the states, really closely with NASPA, but we're also working closely and meeting with HHS to make sure that they're aware of the concerns and questions that are coming up and the barriers that still exist in the states, and asking them to provide clarification so that the states such as Connecticut can turn to something in writing publicly that really makes it clear what the scope of this preemption is and how it impacts in the states.
Yeah. Well, one other thing that was in those 2 slides that you went over, Elisa, relative to the orders was a little bit of something called the ACIP recommendation. So Mitch, I want to turn a question to you here. Under the HHS Authority for COVID-19 vaccines, pharmacists are going to be required to administer the COVID vaccines according to ACIP recommendations. What can you share with us about ACIP recommendations relative to COVID vaccine? It's not here yet, so there aren't any recommendations currently. What's to come? Can you share anything about that? And what if there's an emergency use authorization that's put in place by FDA, but the ACIP hasn't yet recommended the vaccine? What are pharmacists able to administer and order the vaccine under the authority? A lot of questions in there. I'll let you address them.
Thanks, Michael. So under the authority, both of the aspects need to be met. So the FDA authorized or approved or licensed needs to be met, and then also the ACIP making a recommendation specifically for the vaccine. So ACIP has a working group on the vaccine. They're meeting very frequently to look at the clinical data, and we'll come out with recommendations. The intent is that just like with other vaccines, they are our scientific expert body for immunizations. And so there's voting members, and there's also liaison members. APhA actually has a liaison seat on ACIP. And so we are actively engaged in the task force as well as the ACIP. And just to say, you know, Michael is APHA's representative to that task force. But I think the key to it is that the clinical evidence is going to be looked at and a recommendation coming out from ACIP, which then puts in place several different things. From a lot of payer perspective, payers depend upon ACIP recommendation to then go into action in terms of coverage of a vaccine. So the expectation is ACIP will issue that recommendation, and then payers within a period of time will then make that a covered vaccine. And so it's important, again, to give providers, practitioners like pharmacists, the comfort level that the vaccines have gone through the scrutiny and evaluation like other vaccines. The recommendation comes out, and then the system goes into play.
That's great information. And just to, further give a little bit more information to our listeners, I think that, we have to recognize that there will be likely very limited supplies of COVID-19 vaccine in the initial days. likely, based upon a document that was released publicly yesterday that many of you may have seen in the news from the CDC, a draft distribution plan. It looks like the initial distribution will come through state health departments. And so if pharmacists are actually working with state health departments under the authority of the state health department to administer those early doses of COVID vaccine, you're administering those doses, and you can do that under your state authority to administer vaccines. What Mitch is talking about and what we were talking about relative to ordering COVID vaccine and administering is really related to when you're practicing within your pharmacy and not under the authority of the state health officer during the emergency. Becky, is that a fair assessment?
I think it's a fair assessment, and I don't know whether this is the right time, but I think that it's important, so I don't want us to leave without highlighting this, is that there are a number of manufacturers that are producing vaccines. And with those vaccines, when we do get ACIP guidance, they may be for different age groups. They may be for different populations. They definitely will have different storage and handling requirements. And as we currently understand it, all of them are going to require 2 doses, which you need to make sure you give the first and second dose to the same individual. But I think that pharmacists need to look at this like they do pneumococcal vaccine or, in a flu vaccine. There are different requirements based upon different types of pneumococcal vaccine. And I think that we need to start thinking about the COVID vaccine in that same regard, that there are going to be different recommendations for different vaccines. And we need to be prepared for that and embrace it, just like we do for other vaccines that have different recommendations for different type manufacturers and different strains of their vaccine.
Right, that's good information. Well, I'm going to kind of summarize. We've got several more questions, and unfortunately, because of time, we can't get to all of them. But there's been a lot of questions about billing, a whole lot of questions about billing for these vaccines. And let me just do this. I want on the next slide, I believe we have a resource page, and I just want to call everyone's attention to the Pharmacist Guide to Coronavirus, which is available at pharmacist.com. This is a very rich set of resources to really designed to help you in your practice administer and implement coronavirus vaccines, and to know what to do with the drug therapies, and to know how to take care of patients and deal with personal protective equipment. I mean, there's just really a whole lot of things that are here. You can even volunteer to be a part of the vaccine studies and get a link to those pages here. Really a rich resource. We would highly encourage you to bookmark this on your computer. The information is changing constantly and being updated regularly with answers to important questions like, how do we do the billing for these vaccines? And as we have more details, we'll create resources and have those things available for you on this page. And that's why I'm encouraging you really to bookmark this page and really take advantage of this opportunity. Elisa, Mitch, and Becky, thanks for being our panelists today. We'll let you go, except Elisa. We're going to hold on to her for just a moment.
The president and the administration issued a drug pricing executive order. This is a continuation of a series of executive orders related to drug pricing that the president issued about a month ago. Here, basically, he issued in there that the pricing, he issued an executive order that he alluded to a month ago, but didn't share it publicly. This time it was shared publicly, and basically it will tag the pricing for drugs, for certain drugs, to international prices. And in the executive order, it was Medicare Part B and Part D. Drug importation was also brought up. So as you may know, APhA and many pharmacy organizations commented on a proposed rule that would create a drug importation program in the United States to import drugs from Canada. We very adamantly opposed that and identified significant public safety concerns and patient safety concerns. It sounds like that drug importation regulation is going to be finalized very soon. We have information that it is in the last stages of review at the White House, and that was posted on an OMB website late last week. And it's unclear where rebate reform is and whether DIR fees will be included. So we're continuing to watch that. We are continuing in our efforts. We still are pushing hard in Congress in order to get the provider status, the provision for provider status for administration of COVID and influenza testing and immunization for covered as providers under Medicare Part B. You guys have been great in submitting letters. We have this website on our page, if you go to, that helps you very easily submit 3 letters to Congress, to your senators and representatives. And so go there, it's easy. Help, we need more. Congress didn't do it. They're still debating on what needs to go into a COVID relief package, and even trying to get the making sure the government stays open beyond September 30th. Michael, before you go, I think you were going to do the next slide, but I wanted to mention that in the first 2 slides that I went through, they were charts. And just today, those charts were put up on the resource page that you're going to be talking about. So if anybody wants to see that and have it handy, you can go to the resource page.
Oh, that's great. Thank you. Yeah, thank you, Elisa. I appreciate that. And as Elisa said, we have our COVID resource page. I've mentioned it before, but there are new resources on PPE during the pandemic, and also COVID-19 basics has been updated. The NABP passport program has been updated, and engaging the pharmacy workforce has been updated. And this chart that you just mentioned is also there. We do have another CE, lots of CEs that are available. You'll notice here there is catch up and keep up with immunizations in the era of COVID-19. That is available to you as an asynchronous CE opportunity. So take advantage of that. This will help you, I think, a lot with pediatric immunizations in particular, and learning how to catch patients up. Today, immediately, well, almost immediately following today's webinar, APhA has another CE opportunity for you that you might want to register for when you finish today's webinar. It's the Pharmacist's Use of Immunization Information System Data, or registry data. And we talked about registries in today's program, but if you really want to understand how registries work, how these systems work, and how they can work in your pharmacy, well, you might want to take a 30-minute lunch break when we finish today's call and get on this CE and spend an hour, get some good CE and good immunization education. APhA does have a complete immunization continuing education library, including ways that you might be able to access the certificate training program through our licensed partners. And in addition, there are 15-minute CEs available called APhA's 15 on COVID-19. All of these are direct links, folks, you can click on in your handouts tab to get directly to it. The last slide I want to cover with you is that next week we're going to do something we've never done before. Tell your friends about this one. This is going to be a unique opportunity. The entire APhA Board of Trustees will be joining me on the webinar next week, and it'll be an opportunity for you pharmacists to be able to let your voices be heard and share with the APhA Board of Trustees the issues that are critically important to you in your practice today. So we'll be listening very carefully to what your needs are and what your issues are, and it will help drive APhA strategic planning, because just next week, during next week, we'll begin our strategic planning process So having your voice heard will be very important to helping APHA plan for the future. Ladies and gentlemen, thank you for joining us today and sticking with it. Becky Sneed again, Lisa Bernstein, Mitch Rotholtz, thanks for being our guest today. We appreciate you. For all of you that are out there, thanks for everything that you continue to do during this pandemic in your community. Good luck and God bless.